Cervical rotation, fulcrum is the center of the head, stationary arm, acromion process, and moving arm is the tip of the nose. Rotate. Normal rotation is 60 degrees. Cervical spine extension. Stationary arm is parallel with the ground. Moving arm is in line with the base of the nares, and the fulcrum is at the external auditory meatus. And I'm going to have you extend your head backwards. And normal should be 45 degrees. This is cervical spine flexion, which is very similar to cervical spine extension, just going the opposite direction. So your stationary arm is still parallel with the ground. The fulcrum is at the external auditory meatus, and the moving arm is at the base of the nares. And go ahead and flex. And normal should be 45 degrees. This one is cervical side bending or lateral flexion, and your stationary arm is going to be perpendicular with the ground or in line with the spine. Your fulcrum is going to be on C7, and your moving arm should be on the occipital protuberance. And go ahead and bend. And I want to double check to make sure I'm in line, and normal should be 45 degrees. This is trunk rotation. First, I'm going to have my patient put their hands on their hips. This is so I can line up my stationary arm with the iliac crest. And now I'm going to have my patient hug herself. And I'm going to follow with the moving arm, the AC joint. And the fulcrum is at the center of her head. And I'm going to have you rotate. And normal rotation should be 60 degrees. This is lateral side bending or lateral flexion of the trunk. Your fulcrum is going to be at L5 or S1, and your stationary arm is going to be perpendicular with the floor, and your moving arm is going to be in line with C7. I'm going to have my patient bend, and normal should be 45 degrees. Okay, this is for pronation. You're going to have your patient sit with their elbow tucked and their arm at 90 degrees, holding a pen. Your stationary arm is going to stay parallel to the perpendicular with the floor, and your moving arm is going to be parallel with the pen. Your fulcrum will be lined up with the third MCP joint. And go ahead and rotate your hand in. And I follow the pen, and it should be between 80 and 90 degrees. Supination is very similar to pronation, just going in the opposite direction. So your fulcrum is going to be at the third MCP. You're going to keep the stationary arm perpendicular with the floor, and you're going to keep your moving arm parallel to the pen. Go ahead. And your normal should be 90 degrees. This is for wrist flexion. Your fulcrum is going to be at the triquetrum. Your moving arm is going to be in line with the fifth metacarpal, and your stationary arm is going to stay in line with the styloid process. I'm going to have you flex your hand, keep everything in line, and normal should be 90 degrees. This is for wrist extension. You're going to have your patient sitting in a chair beside the table and their forearm supported by the end of the table. The fulcrum is going to be in line with the triquetrum, and your moving arm is going to be in line with the fifth metacarpal, and your stationary arm is going to stay in line with the styloid process. I'm going to have her extend her wrist, and normal should be 70 degrees. Ulnar deviation, you're going to have your patient sitting with their arm flat on the table. Your fulcrum is going to be right below the Lister tubercle where the ditch kind of lays. Stationary arm is going to be in line with the forearm, and your moving arm is going to be in line with the third metacarpal. Make sure it's metacarpal and not finger. Go ahead. And normal should be 35 degrees. This is radial deviation. Your fulcrum is going to be on top of the Lister's tubercle, like right below it in the ditch. Your stationary arm is going to be in line with the forearm, and your moving arm is going to be in line with the third metacarpal. Go ahead. And normal is 25 degrees. This is elbow flexion. You're going to have your patient laying supine with their arm straight. Your stationary arm is going to be in line with the humerus. Your fulcrum is going to be in line with the lateral epicondyle, and your moving arm is going to be in line with the styloid process. You're going to ask your patient to bend their arm, and normal should be 150. Shoulder flexion, your stationary arm is going to be midline of the axillary line of the thorax, and your fulcrum is going to be at the lateral side of the greater tubercle, and your moving arm is going to be in line with the lateral epicondyle. So I'll have you put your hand above your arm. And normal should be 180. Internal or medial rotation, patient should be supine with their arm at 90 degrees. Your fulcrum is going to be at the olecranon process. Your moving arm is going to be in line with the styloid process, and your stationary arm is going to stay perpendicular with the floor. Go ahead and make sure you keep everything in line. And normal should be 90 degrees. This is external or lateral rotation of the shoulder. Patient is going to be supine and shoulder is going to be abducted at 90 degrees. Your fulcrum is going to be on the olecranon process. Your stationary arm is going to stay perpendicular with the floor, and your moving arm is going to stay in line with the styloid process. Go ahead. And your normal should be 90 degrees. This is for abduction. You'll have your patient laying supine and their arm out and thumb up. Your fulcrum is going to be on the medial side of the acromial process. Your stationary arm is going to be parallel with the sternum, and your moving arm is going to follow the medial epicondyle. Go ahead. And your normal should be 180. This is for shoulder extension. Your patient is going to be in prone, and you're going to have the fulcrum in line with the greater tubercle. Your stationary arm is going to be in line with the thorax, and your moving arm is going to move with the lateral epicondyle. And go ahead. And your normal should be 45 to 60 degrees. This is hip abduction. Your fulcrum is going to be on the ASIS, and your stationary arm is going to be horizontal with the other ASIS. Your moving arm is going to be midline of the patella, and you're going to have your patient laying supine, and make sure they keep their foot up. And go ahead. And normal should be 45 degrees. This is hip adduction. For this one, your patient is going to be laying supine, and you want to make sure they keep their toe up. To start off, your fulcrum is going to be on the ASIS. The stationary arm is going to be horizontal to the other ASIS, and your moving arm is going to be midline of the patella. Make sure that you start in a 90-degree position so that you don't skew the results. And you're going to have your patient bring their leg in. And normal is 25 degrees. This is for hip flexion. Fulcrum is going to be on the greater trochanter, stationary arm in line with the trunk, and your moving arm is going to be in line with the lateral epicondyle. Go ahead. And normal should be 120. This is for hip extension. Your fulcrum is going to be on the greater trochanter. Your stationary arm is going to be in line with the trunk, and your moving arm is going to be in line with the lateral epicondyle. Go ahead. And normal should be 10 to 30 degrees. With this one, you want to make sure that the hips do not come off the ground and there's no rotation. This is for hip external or lateral rotation. Your fulcrum is going to be at the middle of the patella. Your stationary arm is going to be perpendicular with the floor, and your moving arm is going to stay in line with the mid lower leg. Just a reminder for this one, your foot is going to go the opposite direction of your hip. So for this one, your foot's actually going to go in. And go ahead. And normal should be 45 degrees. This is for hip internal or medial rotation. Fulcrum is going to be in the middle of your patella. Stationary arm is going to be perpendicular with the ground, and your moving arm is going to stay in line with the midline of the lower leg. Go ahead. And that should also be 45 degrees. This is for knee flexion. Your fulcrum is going to be at the lateral epicondyle. Your moving arm is going to be in line with the fibula into the lateral malleolus, and your stationary arm is going to stay in line with the femur into the greater trochanter. Your patient's going to flex their knee. Just make sure everything stays lined up. Normal would be 150, but functional range is 120 to 135. This is for knee extension. For this, you want to have your patient's foot up on a towel, just in case they have any hyperextension. Your moving arm is going to be in line with the lateral malleolus. Your fulcrum is going to be in line with the lateral epicondyle, and your stationary arm is going to be in line with the greater trochanter. And your normal should be between 0 and 5 degrees. This is ankle inversion. Your stationary arm is going to be in line with the lower leg. Your fulcrum is going to be between the two malleolus, and your moving arm is going to be at the second metatarsal. Go ahead and move your foot in. And normal range should be 25 degrees. This is for ankle eversion. Stationary arm is going to be in line with the lower leg. Your fulcrum is going to be between the two malleoli. And your moving arm is going to be in line with the second metatarsal. And then go ahead. And then normal is 20 degrees. This is ankle plantar flexion. For this one, your patient's going to be short sitting. You want to make sure you start their foot at 90 degrees. The fulcrum is going to be at the lateral malleoli. The stationary arm is going to be at the midline of the lower leg, and your moving arm is going to be parallel with the fifth metatarsal. Go ahead. And normal should be between 20 and 50 degrees. This is ankle dorsiflexion. You want to make sure your patient is in short sitting and that you start at 90 degrees. Stationary arm is going to be midline of the lower leg. The moving arm is going to be parallel with the fifth metatarsal. Go ahead. And normal should be about 10 degrees.